There are several currently available, commercially available imaging modalities for PSMA targeted imaging of prostate cancer, but there are some newer scientific, slightly different structure that offers some potential promise. And the copper-based 64 SAR-bisPSMA from Clarity is one of those molecules that's structured a little bit differently than what we've been using thus far clinically for the last year or so. And it does potentially have some benefits, and there's some unique natures to its scanning. One of those unique aspects is it's kind of got two different PSMA binding motif areas, and it is a copper signaling molecule within a chelator that basically holds it within almost like a cage, as a way for a simple urologist to think about it. And that copper is then basically contained there to these two PSMA binding motifs that are then able to bind to prostate cancer cells expressing PSMA, and it may be more sensitive with two different binding motif areas, and then potentially also more specific because it's requiring potentially two different markers in close proximity to be able to be aggregated within that tissue. So one of the other factors related to the structure of the molecule is that it does have a slightly higher uptake within the tissue than some of the previously gallium-based markers that have been on the market. And so they have some side-by-side comparisons in the same patients. But probably the unique clinical kind of operations factor is that it does enable same day and also next day imaging. And actually there's kind of aggregation of the marker within the tissue, such that imaging out to a 24-hour time point after the day after the injection actually tends to light up more in the small nodal complexes. So it may allow for identification of smaller nodes, specifically in the pelvis. And that's of some interest in a preoperative planning standpoint that may offer us some ability to find smaller deposits of metastatic disease that could change kind of an operative plan. Now, that also does require us to be capable of doing dosing, administration, and then sequencing, potentially imaging the next day. And because of the half-life of the copper compound being a little over 12 hours, that does enable kind of ordering ahead of time. It has some sort of shelf life that we're able to utilize. And so it's not as much of a like produce it and use it within a few hours. So it does give us a little more leeway than some of the currently available molecules that are on the market. From a performance standpoint, compared to what has already been seen with the gallium, there have been some side-by-side studies looking at uptake within lesions for the gallium and then the copper-based molecules. And so some of the previous trials done thus far in same patient imaging with the two tracers, so that there is more uptake with the copper-bisPSMA, whether that's due to the binding motifs having kind of two opportunities for binding, or whether it's due to the chelator holding the copper in that tissue for longer. I can't really speak to that as a clinician other than saying it is brighter on the imaging, and with further accumulation potentially in that imaging and more washout of the tissue noise, it may offer some clarity in terms of what is truly uptake in PSMA positive versus what is background noise. So far the side-by-side has shown higher uptake for a copper-based tracer like bisPSMA versus the 68 gallium PSMAs that have been available. So this is currently being studied in a Clarify clinical trial that is basically for patients who are high risk of having metastatic disease. So they're clinical NCCN high risk. So either T3 on biopsy, grade 4 or grade 5 grade group on biopsy, or have a PSA over 20. Currently scheduled for prostatectomy. And during kind of the screening phase, identify those who've had standard of care imaging, which can include other tracer molecules by PSMA PET or CT and bone scan. But if they're eligible for the trial and planning on surgical intervention, they would then receive the imaging molecule, the copper SAR-bisPSMA, and they would have a scan that day. And they also have a second 24-hour later scan. And basically all that is done in the preoperative period, such that up to day 90, so within the 3 months after this copper-based PSMA is obtained, they would then proceed to their radical prostatectomy with pelvic lymph node dissections. And that's really the setup of the trial, is looking at the histopath from nodal dissection versus what was seen on imaging. And those results are obviously blinded from each other, so that if there's uptake noted on imaging and say the right iliac nodes, they're able to look at both right and left iliac nodes from the prostatectomy specimens separately, and try to decide if it is able to not just call pelvic lymph node spread, but actually identify laterality. As it is right now, almost all of our molecules and tracers are used on the same day. They're ordered. There has to be certain timelines for prep. That does limit some of the scanning opportunities in terms of timing. So next day, excuse me, out to 24 hours from the dosing does offer a lot of options in terms of scheduling flexibility, but it will definitely change the way that we're managing patients if they have to come in, travel to the office, and be delivered the tracer and then come back within 24 hours for their scan. So it will take some operations from us to try to figure out how to do it. Now, it does give us more flexibility in terms of timing, but there's some real benefits potentially if there's more uptake in the tissue, that there's really no need to have the tracer injection and scan tied to each other within that same 1 hour of uptake time. It does give us a little bit more flexibility to do an injection in the morning and then have the patient come back the next day for their dose, and it doesn't have to be timed specifically based on when their tracer was given. So there's some benefits to it, but from an operations side point, from a private practice or from an imaging center and an academic center, it will definitely take a little bit different sort of scheduling to have two visits versus one.